everyone on a short notice for chiming in on this, and thank you everyone for being muted. My biggest hope is to share information. I am very thrilled, that's a good word, Lacey, thank you for that word. I'm very thrilled that we are seeing such an interest in vaccinations because, as you know, many communities don't want a vaccine. We have heard lots of conversations about who has what and who has what designations. And in summary, I would just like to come out so that everyone can feel a little more at ease with the information available. And the information available is late Saturday night, the state has changed our status to a hub status. But to me, and I'm not being negative, but to me, that doesn't mean anything until I get vaccines, because you could label Hays County a hub and send us fewer than 2,000 vaccines. And so what are we doing? Or you don't have to label us a hub and send us 10,000 vaccines and watch us get to work. So the hub designation doesn't move me. I'm unmoved by it. The vaccines that the computers say, we can see the numbers too, the computers that say we're getting vaccines, again, I won't count my chickens until they hatch. Once we have vaccines in our possession, we will shout it from the mountaintops. We will tell the community in every way we know how, vaccines are here and our portal is open, and register. And within 48 hours, I promise you that they will all be spoken for. That's just the demand that we are seeing. Currently, we have the direction of the state. We have, as part of the hub we support, everyone needs to go to Austin Public Health and their system to register for vaccinations. The other option is Bexar County. We don't have another choice. That is what we are told by the state, and that is what we follow. Our hope is that we do actually receive more vaccines. Our population is nearly 300,000. I'll approximate that we are at 300,000. And for all intents and purposes, we have received no vaccines. And so when these come in, we will do, believe me, we are ready. And we will do whatever it takes to make sure that the 1A and 1B group, again, that the state is guiding us through, will get the first shot of access to these vaccinations. Is there something specific that I could address that I may have left out besides rehashing a press release we just put out? Maybe that we could do a hand raising and Kim can call on you one by one.
Will Dupree here in the KXAN live studio. Thank you all again for joining us here in our stream. You're hearing from the Hays County Judge Ruben Becerra after the Texas State Department of Health Services identified Hays County as a mass vaccination hub, joining dozens of others all across the state to first receive the biggest amount of the vaccines. But right now, let's listen in, backing into the county judge in Hays County about this new announcement that's come just within the last few hours.
That we anticipate about 1,900 doses to be delivered.
Can you close it? I don't know if I closed it.
Luz Moreno, you're not muted. Sorry, can you repeat that, Kim?
Yeah, of course. I'm sorry, I was just going to go mute somebody. The release says that the health department anticipates receiving 900 doses this week. And so sorry, children just walking in. Hey. It says, will this be the average allocation to Hays County, or how many doses does the department expect to receive in the future?
So we have no idea what we're getting. The computer says that we're getting approximately just under 2,000 vaccines, but we don't know what we're actually getting. Anything can happen between now and an actual delivery, and we don't know if and when we'll get more. We are truly in the dark like the rest of the community, and I know that it sounds counterintuitive for a press release or a press conference to come out with very limited information, but my hope is to tell you what we have so that everyone will be on the same page. And what we have is the state is driving this bus and we are passengers in it, and we will update you on where we are exactly, and we will recalculate at every single turn and share with you the new information.
Thank you, Judge. The next question is, who will be making the decisions on who gets vaccinated?
So the state has already made that decision. The drop in the bucket of vaccinations that are supposedly en route have already been designated vaccinations for the 1A and 1B community. And if you are part of that community, you should log on to the portal once we turn it on and register for them, because I'm the youngest of 5 in my family, and so my biggest hope is to learn from what those around us, slightly larger than us and much larger than us, have done, and the pitfalls they have encountered, and learn from them. And so we have learned a lot from our surroundings, and we are making sure we have doubled down to make sure we don't have the same hangups that others have experienced. We understand the complexity. This is a global pandemic that's not very well federally supported, and our state is struggling because of stockpiles that weren't there. And so we are all sitting here with very little and trying to do the best we can with it. And so just know that as things unfold and actually arrive in Hays County, we have oiled this machine and we are ready to receive them, and you will be immediately notified to log on as a 1A and 1B.
Thank you, sir. The next question is, if Hays County wasn't originally selected to be a hub, what efforts were made to change this?
So we have submitted to the state our abilities, our plans, and our components, and all the intricacies of, put us in, coach, we can do this. And of course, I wrote a letter to the governor asking kindly for them to please consider Hays County, a very near neighbor, to give us vaccinations, because I believe wholeheartedly in public-private partnerships, but vaccinations only in private practices, I don't believe, as a director of emergency management, is the most useful way to mass vaccinate. And so it'll be hard to know exactly if the governor saw my letter and said, oh, okay, I remember Ruben, let me send him an update. So it's hard to know for sure, but I have done the calling, I have done the letter writing, and I have done through the rest of our team other components of reaching out to, the acronym is DISHES, the Department of State Health Services, Division of Emergency Management. We are in daily constant contact with state assets. So I think they're hearing our ache.
All right. Can you hear me? Judge,
Yes.
nod your head if you can hear me. Okay. I think my internet occasionally doesn't like to work. When can we expect the registration portal to be ready? I think you've already addressed this, but I guess
I've addressed it, but I will recap it in case someone wants a soundbite. I want to be useful to you guys. I really appreciate everyone that's on here, and I want to give you everything you need so that you can properly report what your audience is looking for. And I genuinely want to say at this moment, I'll take this chance to say thank you to everyone that's on this call, because you're interested in what we're doing, and we are grateful that you are helping us to disseminate the information to your audience. So I will repeat myself. I will keep answering the same question in every way I can that is most useful, because you need to get what you need to get it to your audience. So your question was, who's going to get can you repeat the question?
Yes, sir. That question was, when do we expect the portal to be ready, to be open to register?
So the portal will open when we know we have vaccines in our possession. And I will tell you, I am not worried about us having the portal open the moment we know we actually have vaccines in hand, because having them here is key. We can see them on a computer screen. We can say they're in that truck down the street on I-35. It doesn't matter. I can't bring our community's hopes up until they are in my possession. Unless and until they are in our possession, we will not turn on the registration portal. And I will promise you this, like a Black Friday special, we will open the portal, and within 48 hours, we will have filled every spot for the 1A, 1B. And it will take no time for us to get those vaccines in our community's arms that fit that criteria, and we will do it effectively. Promise.
Thanks. So this is more of a statement. I'm not sure what I'm trying to get at here. But one of the things I've heard repeatedly from our health department and from the judge and from emergency operations, from the state, from Austin Public Health, is this situation requires quite a bit of patience for us and for the public. And so I hope that we can just sort of emphasize that as we're moving forward, that while we don't have all the answers at this moment, we are working together. The judge is working very hard. He's got a lot of folks backing him up, trying to make things happen. So I think we're hoping that everyone will understand. It isn't a perfect system, but we're asking for your patience as we, muddle through this together.
That is such a good statement, Kim, and you're right. And I really do encourage us as a community, and we're all part of this community one way or another. Let's find those pieces that unite us. We are all either residents of San Marcos. We are all residents of Hays County. We're all residents of Central Texas. We are all Texans. I don't care where you slice this. We're all in this together. And let's realize and remember and reassure one another that it's no use, it's of no value to attack one another. Believe me, if I could make vaccines, I will. But I can't. And we're at the mercy of the federal government and what they're putting out through the organizations making the vaccines. And the state is doing their very best to dispense them, and they have a lot of fires to put out. It's just reality. And so I really do appreciate that, Kim. It's very important that we remain kind to one another. Let's treat each other the way we would like to be treated. I know that there are school board members and city council members that are very frustrated. I'm sure they're getting lots of calls, but just know this, we're all one people, and we're all going to give everyone the vaccine that wants it in a timely manner, in an intelligent rollout that is guided by the state's direction. Are there any other questions, Kim, or do we want to open it up?
I think we might be able to open it up. I actually haven't seen any
Hands raised?
hands raised. Yeah. So, and
Mike,
the
I
only
see
chat,
Mike here.
chat I see is somebody
Kim,
wanted
before we
permission.
go on, I see Mike here, and I wanted to ask Mike, is there something that you find of value worthy of repeating or stating, Mike? Mike is our emergency management, emergency services director for Hays County.
Afternoon, Judge. I think you said it quite well. The patients, when we had the vaccine, we're going to be telling the nation. More importantly, we'll take care not just of our residents here in Hays County, but our contiguous counties too. So we will follow this hub program just as it was meant to be, and that is to be the focal point for everybody who's touching our county and take care of every resident that comes inside this county. We'll get them a vaccine. Just be patient with us. As we start small, we'll grow large.
Thank you, Mike. That's a great optimistic message, and that's how we got to be. We're not going to get a bunch of vaccines and put them in a box or put them in the sand. We're going to put them in your arm if you want them and if you fit the criteria, because we got to go layered 1A, 1B, as you all know, and move on through it. So, as Mike has said before, this isn't a titanic situation, and we're grateful that we have an opportunity to roll this out intelligently. And those that don't need it right away should ideally allow us to get the most help to the people that most need it, the people that can't stay home, etc. Pre-existing conditions, the description of 1A, 1B.
Judge, there's a question here from Sahar. She is with the Hays Free Press. She said, what is the difference between vaccinating through the county versus private practices?
That's a very good question. Thank you for asking it. So what happened in the very beginning was I had an opportunity to push the state again for mass testing. And I was so grateful that the Division of Emergency Management helped us. And with our National Guard, we had mass testing. And even to this day, it is massively available. And I'm just so grateful to the state for that. That's why I won't get negative about it, because it's of no value. They're doing what they can, and I believe it. And so if we would have taken that testing and left it only in private hands, there's no way we could have tested as many people as we tested. So it's identical in the vaccination effort. We have seen a list of Hays County private practices receive vaccinations that we have no control over. We're grateful that they have them. We're grateful that they're helping us take care of all the 1As and 1Bs. They are doing what they're supposed to be doing. But at the same time, we have no idea the volume and the capacity, the breadth and scope. And so what I would like to say is include in the public-private partnerships, include the county, we're charged with public health, so that we could dial up vaccinations in mass like we did testing. And so there's a stronger level of awareness of the whole county versus small practices and small pockets. So I feel that's the difference.
Okay, we have two reporters who are online. I'm going to go to Rianne first. I believe she has two, and then Warren from Community Impact, he will be next. So let's start with Rianne.
Hi there. Thank you to both of you for organizing this. Judge, I just had a quick question for you about last week's Facebook Live. I just wanted to clarify something. I know that you and a couple other people mentioned that we had 300 doses, or we have 300 doses. Is that something that we actually physically have? Is that just an allocation, or what's up with that 300 number?
Great question. So I was told that we received 300 vaccines that, of course, evaporated on the hot concrete like a drop of water. And so what we did with those, I'm sure, is exactly what the state is telling us to do, 1A, 1B. And so, like, I hope we could continue to get more vaccinations. The number we received has just been absorbed into that space.
And my other question was about the plans that you all have been talking about. Is there any intention to share that with the media, with us, maybe ahead of getting actually enough vaccines to implement those plans?
So we have a few roadmaps, and that's why I continue to press on the public-private partnership. We have a few roadmaps, a few tools in the kit with which to dispense depending on the number of vaccines that are allotted to us. We have a tested, it's called a tabletop exercise, and then you go out and actually produce the event, put the cones out and drive through it. We've done these things already, so we have the capacity to work through a clinic. If we get a tiny little 0.1% of vaccines that we have in reference to our population, we can run that through a clinic with not a finger to lift for a cone or a parking spot designation, all the way up to a performing arts center where we could have a mass vaccination effort. We can create a drive-through. It's kind of like a menu. Depending on what we get, we have the options to get them out in a timely manner, most efficiently. Because these aren't things we have to invent. These are things that we pull from because we are part of a bigger machine. They're called COGS, Councils of Government. We're part of the State Division, Emergency Management. So we all have these ideas that are circulated and then just fine-tuned for our specific footprint. For example, if we say we're going to do vaccinations at the high school, okay, so there may be a small shift in how we place the cones, but the blueprints are pretty much the same.
Got it. Thank you.
Yes, ma'am.
All right, Warren, you're up.
Thank you. I just had a quick question about looking at the county's description of 1B here, looking at frontline workers, workers who maintain critical infrastructure, and I'm curious about how the county is defining this. Is that including law enforcement officers, government officials, government employees? How does that kind of fit together?
That's a wonderful question, Warren, because a lot of people are unsure, where do I fit in? We have and will continue to follow the state's designation. If there have been some typos in anything, or if someone has shared misinformation on accident that is truly just an accident, we have every desire and intent to follow the state's designations of the 1A and the 1B categories exactly and completely as they are outlined.
Sorry, but just to kind of clarify there, does that include, sheriff's officers?
Yes.
Oh, yes.
Yes, all those that you've described are included in that category, yes, including teachers, yes.
Okay, thank you.
Yes, sir.
Okay, let's see.
I really do, while Kim is looking, I really do appreciate everyone taking this time to get filled in so that you could share this information with the community. You are doing a great service to share this with folks in a way that's complete, as I know you will. Thank you.
All right, any other reporters, if you have a question, feel free to unmute yourself and go ahead and ask.
There we are. Okay, Kim, if anything else comes up, please email Kim. Although this is a technical holiday, of course, we're on 24/7. We don't rest. We're always on for you. Feel free to email Kim She will get the information and we'll get you the answers that you need. If you think of something after we get off this call, just know that we're always here for you. So thank you very much for being here, and we're genuinely grateful for the work you do in our community. Have a wonderful day.
Thank you, everyone.
Kim, I do have a question.
Okay.
Am I gonna have access to this? I was trying to record it, but it wasn't letting
Yeah,
me.
I recorded it, so I'll make sure everyone gets a copy.
Alrighty, thank you.
Will Dupree here again in the KXAN Live studio. We've reached the conclusion of that Zoom that was held with the Hays County Judge Ruben Becerra there. Today, the county is telling everyone that the Texas Department of State Health Services has designated Hays County as a mass vaccination hub. There were other areas throughout the state that already received that designation. The state agency is now widening that and allowing a few other places to receive that designation, meaning they will be the first ones to get larger shipments of either the Pfizer or the Moderna vaccines. We should just point out, the federal government is divvying out these particular shipments of doses from these two vaccines to the states. The states then have the responsibility to get that out to the different providers all across the state. The state has now adopted this policy where mass vaccination hubs will get the largest shipments of the vaccines, and then other providers will also be able to receive those doses too, just in smaller amounts. So just want to clarify that with everybody and point out that Hays County, yes, it has been designated as this mass vaccination hub now by the state. However, it has not received the amount that it is now promised. The state has said earlier today that Hays County could get up to 1,950 doses of the Pfizer vaccine. That's as its hub location could get that many, almost 2,000 vaccine doses from Pfizer. However, the county has not received that just yet. The county judge also said a few moments ago that there will be a portal that the county will put up online so that people can go on there, register and sign up to get a vaccine through the Hays County Health Department. That portal is not live just yet. What they are doing is they are waiting to receive those vaccines in hand. Then they will put the portal live and then make that available so that people can sign up and potentially get a shot. They don't want to put up the portal, they said, until they get those shots in hand. So they're asking for patience. I know that's what all these different agencies are asking for at this point, so we'll hope you grant that for them for sure. But again, Hays County has been designated as a COVID-19 vaccination hub by the state of Texas, and it is supposed to receive almost 2,000 doses of the Pfizer vaccine potentially this week. However, the county just does not know yet, as I said a moment ago. I was monitoring as we were doing this stream some of the comments left on the Facebook feed for some of the people who are watching us there. And one person asked, define who is going to get this vaccine. It's been mentioned that groups 1A and 1B are first priority right now, and that is what will be the case in Hays County. So I just want to pull something up that will hopefully be helpful to a lot of people out there if you're curious about what this is exactly and who can get it. So bear with me just one second. I'm going to pull this up. This again is from the Texas Department of State Health Services, and in their frequently asked questions section, they have defined some of these things. So if you're curious about this, you can go right online and look it up too, but we wanted to be able to share it if you're just joining us. I'm going to make this full screen so you all can see. The Texas Department of State Health Services, under this section right here, who can get the COVID-19 vaccine now, they define it. Frontline healthcare workers and residents at long-term care facilities called Phase 1A, plus people over 65 or with a chronic medical condition that puts them at increased risk for severe illness from COVID-19, Phase 1B, are currently eligible to receive that COVID-19 vaccine. So Phase 1A, that's frontline healthcare workers and residents at long-term care facilities. 1B is people over 65 or those with a chronic medical condition that makes them more at risk to have some sort of serious complication from getting COVID-19. And then it breaks down right here. So phase 1B recipients, again, people 65 years of age and older, people 16 years of age and older with at least one chronic medical condition that puts them at increased risk for severe illness from the virus that causes COVID-19. Those medical conditions include cancer, chronic kidney disease, COPD, heart conditions, solid organ transplantation, obesity and severe obesity, pregnancy, sickle cell disease, and type 2 diabetes. I'm going to leave this up so that you all can just take a look right there. But again, for anybody wondering who is at priority right now to receive these limited supplies of COVID-19 vaccine, it's just groups 1A and 1B defined by the state. And we just went through what kind of people fall into those kinds of categories. So we hope that finds helpful for a lot of people out there. If you would like to know more about this, we have full reporting of it over on our website, kxan.com, and on the KXAN News app, so please download that if you've not done so already. We want to thank you again for watching our stream. Any other updates, we will let you know about as soon as we can. Jump right back on here so we can get you up to date with everything that's out there. Once again, I'm Will Dupree here in the KXAN Live studio. Thank you for watching. Please, everyone, stay safe and healthy, and take care.